Quarterback for the Pittsburgh Steelers, Kenny Pickett, went down with a very bad looking knee injury today, and this knee injury was so severe that he actually had to leave for the remainder of the game. On the play he was injured on, he seemed to get tangled up with the defender, and as he was coming down to the ground, this placed a lot of pressure going through that left knee, and currently as of right now, we don't have any updates. He will have an MRI on the knee, so we're going to have to wait and see the results on that, but based on the anatomy of the knee, we can sort of infer what exactly is going on in this case. Since some people may not be too familiar with the anatomy of the knee and the direction of force on the injury, I want to go ahead and focus on that with this video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I talk about them so that they are a little bit easier to understand. I will also go over the anatomy of the specific injury as well as what that person should expect when in rehab. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we can see here on the play that he's injured on that as the defender is pulling him to the ground, we see that the defender sort of lands on the outside portion of his knee, directing the force inwards. So here I have a model of the knee joint, and so essentially the knee joint is made up of the femur or the thigh bone coming on down and forming the top portion of the knee. Then at the bottom portion here, we have a long bone known as the tibia, which we often call the shin bone. That's going to come up and form the bottom portion on the knee. And finally, along the outside here, we have our fibula bone, which is going to come up and attach as well. There are four main ligaments that contribute to overall knee stability. The first one is that anterior cruciate ligament, or the ACL for short, located right here. As we flip the model towards the inside or medial portion, we have the medial collateral ligament, also known as the MCL. We flip the model to the lateral or outside portion. This is the lateral collateral ligament, or the LCL. And finally, as we move towards the back of the model here, this is the posterior cruciate, also known as the PCL. We also have two other structures that are located medially and laterally. These are the medial and lateral meniscus. Essentially, with these two structures, you can think of them as shock absorbers between the two bones. Now it looks like the force that's being placed on Pickett's knee is known as a valgus force. This essentially is a force that's going from the outside coming in. So as a force is coming from the outside in, you can see that that essentially is going to stress all of the structures located on the medial or the inside compartment of the knee. So whenever we're talking about a valgus force at the knee, essentially what we are concerned with, of course, is that MCL, because that's located along the medial or inside portion of the knee, and its function is to resist any sort of valgus force. And actually, an on-the-field test that we do to determine if an MCL is being implicated in an injury is known as a valgus test. So what we're going to do is have the person's leg like so. We're going to place a little bit of that valgus or lateral to medial force going through the knee. Obviously, it's positive if the person says, yeah, that hurts right along the inside portion of the knee, or we're feeling any sort of laxity in the knee in that area. Now, where this injury becomes concerning is that a lot of times forces are not just perfectly from lateral to medial. There's a possibility that the force is also going posterior to anterior, in which case, what we think about in that case scenario is going to be an ACL injury. A big function of the ACL is to prevent any sort of anterior slippage or anterior sliding of the tibia. So anytime a person is going to get a force going from behind the knee going forward, that's going to place that posterior to anterior force on the tibia, which can stress the ACL. And on the field test we do for an ACL injury is known as a Ligaments test, and essentially we are reproducing once again that force that's going to damage it. So we're going to stabilize the person's femur and we're going to pull up on that tibia. We do this and we compare it to the other side, and essentially if we're feeling any laxity in the knee, that's when we think that a person is going to have an ACL injury. And also another structure that can be involved in this case, because he is having a rotational force going through the knee as he's being brought to the ground, can also be one of the meniscus here. So essentially, as of right now, it looks like any three of these structures could be implicated. Now there is a chance too that there is something called a terrible triad injury. And this is often seen in forces that are going through the knee that are posterior-lateral, going diagonal through the anterior medial side of the knee. And when this occurs, essentially what's being implicated here are the MCL, the medial meniscus, and the ACL all become damaged. Nothing has been released as of yet to determine what exactly is going on, but it is more common to see this terrible triad injury because of essentially the direction of tackles. They usually come from behind the leg, and there's a rotational component which can essentially damage all three structures. The gold standard to determine what exactly is damaged, of course, is the MRI, but once again, there are some on-the-field tests to determine where they're thinking about the potential injury. There's a grading system for these ligament injuries. There are grades 1, 2, and 3. In a grade 1 injury, essentially you're getting stretching of the affected ligament. In a grade 2, this is where you're getting some partial tearing. And finally, in a grade 3, this is where you get a full rupture. So as of right now, the best case scenario is that he's dealing with more of a grade 1, which is essentially going to be a light sprain. Obviously, worst case scenario is a rupture of any of the affected structures. If I happen to hear any updates regarding Kenny Pickett's case, I'll be sure to update everyone in the comment section. Once that MRI report comes out, I'll be sure to do that. Also, if you happen to hear anything, please feel free to update me as well. So we wish Kenny Pickett the best of luck moving forward. It was a tough break today. If you did like this content, I'm gonna go ahead and share one of my playlists with some other knee injuries that I've explained. Thank you for tuning in, and I'll see you next time.